Hi everybody, I'm Dr. Damon De La Cruz. I'm the Director of Education at the Frigid Fluid Company. I'm going to talk for just a moment about pre-injections and co-injections, those modifying agents that are available through Frigid to optimize your embalming. The first chemical I want to talk about is water Clot Guard. I would add water Clot Guard to every tank of embalming solution that I create. Why might I add that, you ask? Because recent reports indicate that 85% of the households across the United States have hard water. That's going to directly correlate to funeral homes. That means the funeral home you're at probably has hard water. What hard water is going to do is going to introduce calcium into the body. That's going to limit your distribution. Calcium will bind to red blood cells and create clots. By adding in water Clot Guard, you will limit the amount of calcium that's going to bind to red blood cells and create those clots. Now, depending on the particular way I like to embalm, my own style, the demands of the case, we have additional pre-injections and co-injections that are options. Our pre-injection fluid is Tissue Aid. Tissue Aid is good to add with about a half gallon to a gallon as a pre-injection solution. What this will do is it prepares the tissue to be ready to assimilate the arterial solution that you create. If the body has less moisture than normal, it's slightly dehydrated, that will make the cells a little bit resistant to embalming chemical. This helps prepare the cells to take on the formaldehyde and become preserved, and the other body tissues as well. Another pre-injection fluid that we have is plasma flow. Plasma flow is going to help with your drainage. Plasma flow will lubricate both the arterial system and the vascular system. So as you introduce your embalming solution, that's going to push the body fluids and displace them with your embalming solution. If you expect that a body is going to have clots, which most bodies do today if they've been sitting in refrigeration for any amount of time, you'll want to use a pre-injection like plasma flow, because this is going to help your distribution be more effective, which means you're going to have better preservation and better results, better distribution of your dye, better distribution of your preservative chemical. Personally, I often do a co-injection as opposed to a pre-injection. For a co-injection, what I like to use is free flow. Free flow differs from plasma flow in that it has trace amounts of formaldehyde, so it works really well as a co-injection, and it also has a little bit of dye to it. This is an active dye, and this will work well with your arterial solution. The drainage that I get when using free flow is superior to not using free flow, so I highly recommend using this as a modifying agent to your embalming machine tank and the solution that you create. Taken together, any one of these supplemental fluids and supplemental chemicals will help the embalming process be optimized, and you should add them to your solution. If you didn't, now you do. Stay curious, folks.